Families fight against Medicaid cuts. A personal story. Imagine a world where essential health care for millions of vulnerable children could be slashed, leaving families like the Latham and Staggs scrambling to fill the gap. This is the stark reality facing families of children on Medicaid due to President Donald Trump's controversial One Big Beautiful Bill, a comprehensive legislation that includes significant cuts to the Medicaid program. But here's where it gets truly concerning. The bill, signed into law in July 2025, threatens to dismantle a lifeline for many families, particularly those with children who have complex medical needs. In Vienna, Virginia, Telvin Latham, a young boy born with a brain malformation, relies heavily on Medicaid for in-home support and other vital services. His mother, Lindsay, shares her fears about what might happen if the program is cut. "If Medicaid stops covering Calvin's care," she says with a heavy heart, "I'll probably have to give up my job to be his full-time caregiver." This scenario is not just a possibility. It's a very real concern for thousands of families across the country. The impact of these cuts extends beyond just individual families. Stacey Staggs from Charlotte, North Carolina, is the proud mother of Emma, an 11-year-old girl who requires round-the-clock medical assistance. Emma cannot breathe or eat on her own, and her daily regimen of medical equipment and specialized formula is funded by Medicaid. Without Medicaid, Stacey explains, Emma's quality of life would plummet and we'd struggle to afford the care she desperately needs. Stacey's concerns are echoed by many other parents whose children receive critical services through Medicaid. At Shining Hope Farms in Mount Holly, North Carolina, Emma participates in various therapeutic activities designed to improve her physical and cognitive abilities. These sessions, including horseback riding and sensory integration exercises, are crucial for her development and are made possible by Medicaid funding. The therapies Emma receives are invaluable, says occupational therapist Erica Warwick. They help her build strength, coordination, and confidence. The proposed cuts to Medicaid have sparked intense debate and concern among advocates for children with disabilities. Some argue that reducing government spending is necessary for fiscal responsibility, while others contend that the consequences for families like the Lathams and Staggs far outweigh any potential financial benefits. And this is the part most people miss: the human stories behind the numbers. To address these issues, groups like Little Lobbyists have emerged, bringing families directly to Capitol Hill to advocate for their children's needs. Stacey and Shani Staggs, along with other parents, participated in these lobbying efforts, emphasizing the importance of Medicaid in ensuring that children like Emma receive the care they need to thrive. "We're not just fighting for Medicaid," Stacey says. "We're fighting for our children's futures." As the debate continues, one thing remains clear. The fate of Medicaid will have profound impact on countless families across the United States. What do you think? Should the government prioritize cutting spending or maintaining essential healthcare services for vulnerable populations? Share your thoughts in the comments below. Pediatrician warns, Medicaid cuts threaten children's lives. Here's a hard truth. When politicians play with healthcare budgets, they're not just adjusting numbers. They're making life or death choices for millions of children. The One Big Beautiful Bill Act, signed into law by President Trump on July 4th, isn't just another legislative headline. It's a seismic shift that will strip nearly $1 trillion from Medicaid over the next decade, a program that keeps 40% of all U.S. births covered. And here's where it gets controversial. This isn't just a political move. It's a direct threat to the health of our most vulnerable kids. As a pediatrician who spent 2 decades in children's hospitals, I've seen firsthand how critical Medicaid is. It's not just insurance. It's the lifeline for families who can't afford care, for children with disabilities, and for newborns needing immediate medical attention. But here's the part most people miss. Medicaid doesn't just vanish. It changes names. In South Carolina, it's Healthy Connections. In Kansas, CanCare. Call it what you want, but cutting it means cutting care, period. And this is the part that sparks debate. When politicians claim these cuts will streamline healthcare, they're ignoring the human cost. Rural hospitals, already stretched thin, will face closures. Emergency rooms will overflow with preventable crises. And let's not forget the ripple effect. When kids can't get routine checkups, their parents face higher bills, hospitals shoulder more strain, and taxpayers foot the tab for avoidable treatments. But wait, how does this work? Let's break it down. Medicaid isn't just about coverage. It's about equity. Children in rural areas already struggle to find providers. With cuts coming, their access will shrink even more. Imagine a family in a small town, desperate for a pediatrician, only to find their local clinic shuttered because Medicaid reimbursements dropped. That's not hypothetical. It's the reality the One Big Beautiful Bill Act is creating. And here's a question for you. Should healthcare be a privilege for those who can afford it, or a right for every child? The GOP's insistence that these cuts will lower costs ignores a basic truth. Illnesses don't disappear just because you can't afford treatment. Patients delay care, conditions worsen, and suddenly a $50 checkup becomes a $50,000 emergency room visit. Physicians know this. We've seen it happen. So what's the solution? Doctors can't stay silent anymore. We need to step into the political arena because the people shaping healthcare policy often have never held a stethoscope. Organizations like the American Medical Association must lead the charge, equipping physicians with tools to explain these cuts to families. But here's the catch. Philanthropy won't fill the gap. Donations and drug company handouts are temporary fixes, not replacements for a public health safety net. If Medicaid funding dries up, pharmaceutical companies will raise prices instead of helping. That's not charity. That's profit-driven neglect. And let's be clear, when politicians gut Medicaid, they're making a choice that will cost lives. I've treated kids with gunshot wounds, diabetes, and mental health crises. None of them were undeserving. They were victims of a system that gave up on them. As a pediatrician and a mother, I refuse to stand by. This isn't just about Medicaid. It's about the soul of our healthcare system. If we don't act now, we'll be complicit in leaving children behind. So I ask you, will you support policies that prioritize profits over people? Or will you demand a system that values every child's right to health? Share your thoughts below. The fight for kids' health isn't over, and it shouldn't be. Annie Andrews, MD, MS, is a pediatrician with 2 decades of experience and a candidate for the U.S. Senate in South Carolina.